Good afternoon, everyone, and welcome to the Nurse's Corner with your nurse, TANEISHA COLQUHOUN. Today we are going to be discussing a topic called diabetes. Simple but very important topic. Diabetes is commonly referred to as sugar. Now, diabetes means that your blood glucose or your blood sugar level in the body is too high. There are two main types of diabetes. You have type 1 diabetes and type 2 diabetes. Type 1 diabetes is where the body does not make insulin. Insulin helps the body to use glucose from food for energy. So people with type 1 diabetes need to take insulin every day because their body just does not produce it. This type of diabetes is found mostly in children and the newborn. Type 2 diabetes is where the body makes or produces insulin, but it does not use the insulin well. So even though the body makes it, the body doesn't use it. So the person with type 2 diabetes, they often have to take pills or even insulin. And this is the most common form of diabetes. This type of diabetes is found mostly in adults. Diabetes is hereditary, meaning if a grandparent or a parent, even an aunt or an uncle has it, we have to be very careful because it is passed down from generation to generation. Diabetes is a very serious condition. You may have heard people say that they have a touch of diabetes or that their sugar is a little high. These words and phrases might suggest that diabetes is not a serious disease. However, that is not correct. It is very, very serious. Taking good care of yourself and your diabetes can help all of us to feel better. It may help you avoid health problems caused by diabetes. A lot of health problems are caused by diabetes. These include heart attack and stroke, eye problems that can lead to trouble seeing or going blind. It can even lead to nerve damage that can cause your hands and your feet to hurt, tingle, and feel numb. That is known as the pins and needles effect. Another condition or another health effect or health problem is that some people may even lose a foot or a leg depending, and the main one is kidney problems that can cause your kidneys to stop working. It also causes health issues such as gum disease and loss of teeth. When your blood glucose is close to normal, you are likely to have more energy. You feel less tired and you feel less thirsty, and you often urinate less. You also heal better and you have fewer skin or bladder infections. You also have fewer problems with your eyesight, feet, and gums. Those are signs that you are healthy and you don't have any issues with your blood sugar levels. Now, how to manage or prevent diabetes? Management is similar to the preventative measures, right? Especially if it is hereditary, you should stick by these. 1, you have to eat healthy foods such as fruits and vegetables, fish, lean meat, chicken or turkey without the skin, dried peas or beans, whole grains, low fat or skimmed milk and cheese. That is one way. Another way is to keep fish and lean meat and poultry portions to about 3 ounces. And we also recommend you bake, you broil, or you grill it. We do not recommend frying any at all. 3, eat foods that have less fat and less salt. 4, eat foods with more fiber such as whole grain cereals, breads, crackers, rice, or pasta. 5, get at least 30 to 60 minutes of physical activity on most days of the week. We recommend 5 days for the week. 6, brisk walking is a great way to move more. So if you have to move from one area to the other, we recommend brisk walking. 7, Ask for help if you feel down. 8. We recommend you learn to cope with stress, as being stressed can also elevate your blood sugar levels. 9. Stop smoking or don't start. 10. We recommend you take your medications even if you feel good. It is very, very important. The medication is to allow you to feel good. So even though you are feeling good, we recommend you still take it to maintain that feeling. 11. Check your feet every day for cuts, blisters, red spots, swelling. This is because you have diabetes causes decreased sensation in your feet, so you have to check them each day to ensure that there's nothing there that can lead to a sore or ulcer. 12. Call your healthcare team right away about any sores that do not go away, because again, diabetes causes decreased healing. 13. Brush your teeth and floss every day to avoid problems with your mouth, teeth, or gums. 14. Check your blood glucose. You may want to test it 1 or more times a day. So as a preventative measure, whenever we go to the doctor, just ask to get it checked, especially if it runs in the family. 15. Check your blood pressure again. Always check your blood pressure whenever you visit the doctor. And lastly, number 16, report any changes in your eyesight to your doctor, because remember, a health problem that is caused by diabetes is that you can have eye problems that can lead to trouble seeing or even blindness. That's it for today for diabetes. Thank you for listening. Before I go, I would like to leave with you the health tip for the day. The health tip for today is try to make at least 3 people smile each day. It will make them feel good, but it will make you feel even better. Again, try to make at least 3 people smile each day.
Ladies and gentlemen,
the number one station. The number one station.
It's always hot.
Tops Radio.
It's always on.
Big, bad, different, entertaining.